Let's now discuss two more extra points, namely Yuyao of fish waist and Taiyang, the supreme yang. First, we have Yuyao. This point is located in the center of the eyebrow, with the eyes looking straight ahead directly above the pupil. How do we find this point? With the patient looking straight ahead, palpate the eyebrow directly above the pupil, superior to the supraorbital ridge. There locate EX-HN-4 or Yuyao in a small depression on the superciliary arch. Needling this point is 0.3 to 0.5 tune vertically or obliquely towards the eye. Its actions or indications include benefits the eyes and dispels pain. Yuyao is used for eye disorders such as blurred vision or floaters, particularly deriving from liver blood deficiency. It is also a useful local point for headaches from liver yang rising when they occur behind one eye. It also treats dull headaches from liver blood deficiency occurring behind both eyes. To summarize its functions, Yuyao subdues liver yang in cases of headache behind the eyes, dizziness, and blurred vision, and also brightens the eyes in cases of redness, swelling, and pain of the eyes, blurred vision, twitching of eyelids, and drooping eyelids. This point first appeared in the classic of the Jade Dragon. In clinical practice, it is mostly selected in the treatment of supraorbital pain and diseases of the eyes and eyelids, and is stimulated by through needling from either Yangbai or GB-14 and bladder 2. Next point we have here, Supreme Yang or Taiyang, or the EX-HN-5 point. This is located on the temple in a depression approximately 1 tune lateral to the midpoint of a line connecting the lateral extremity of the eyebrow and the outer canthus of the eye. So how do we find this point? On the temple, first draw a line between the lateral extremity of the eyebrow and the outer canthus of the eye. Next, palpate from the midpoint of this line in a lateral direction until you can feel a distinct depression in the temporal bone. EX-HN-5 or Taiyang is located in the center of this depression. This point tends to be pressure sensitive, especially with temporal headaches, and patients often get relief by using acupressure on this point. Needling Taiyang is 0.5 to 0.6 tune vertical insertion into the temporal muscle or obliquely in a lateral direction or transversely towards GB8. This point often bleeds when needled, so prick to bleed to drain heat. For its actions or indications, Taiyang eliminates wind, clears heat, reduces swelling, opens the channel, and alleviates pain. Special features. Taiyang is one of the most important and most commonly used extra points, especially with headaches. Taiyang is frequently used as a local point for headaches due to rising of the liver yang or liver fire when the headache occur on the temple. It can also be used for eye problems due to heat, either exterior as in wind heat or interior as in liver fire. So to summarize its functions, Taiyang subdues liver yang in one-sided headache on the temple, dizziness, and tinnitus. It also brightens the eyes in blurred vision, redness, and swelling of the eye, and pain in the eyes. Taiyang is one of the most important and commonly used of the extra points. It was first discussed in the sage-like prescriptions from the Taiping era, the 10th century CE. Although considering its importance in the martial arts tradition as a vital spot where a blow may be fatal, it was almost certainly known much earlier than this date. Taiyang is commonly needled or pricked to bleed in two clinical situations. First, in the treatment of one-sided headaches and dizziness, in which case it is frequently joined to GB8. And second, in the treatment of diseases of the eyes such as redness, swelling, and pain. The Ode to the Jade Dragon recommends bleeding bilateral Taiyang for dimness of vision, and also, surprisingly, needling it in combination with SI1 for swelling of the breasts. Taiyang can be used in combination with other acupuncture points for the following disorders or illnesses. For disorders of the eyes, Taiyang can be combined with bladder 1 and Yu-Wei or MHN7 according to the Ode of the Jade Dragon. For redness, swelling, and unbearable pain of both eyes with photophobia, uh, bladder 1 can be needled with Yu-Wei and Taiyang is bleed. This is according to Song of the Jade Dragon. For swelling of the breast, we use Taiyang and SI1, still according to the Ode of the Jade Dragon.